Everybody high. Atherothrombosis, when repair stays safe and when it becomes obstruction. The word thrombosis carries an almost universally negative connotation in medicine, but in atherosclerosis this understanding is dangerously incomplete. Atherothrombosis is first a repair mechanism, the body's attempt to seal disrupted plaques and rebuild protective surfaces. The critical question is not whether atherothrombosis occurs, but whether it remains localized and wall-adherent or progresses to vessel obstruction. The biology of safe repair. When a plaque surface tears or erodes, platelets and fibrinogen create a localized wall-adherent thrombus. Under favorable conditions, this forms organizes connective tissue covered with fresh endothelium. The plaque seals without obstructing blood flow. Pathological studies of elderly individuals who died without cardiovascular events regularly reveal healed plaques, scarred, re-endothelialized, covered by organized thrombi. The body had been managing the disruption silently for years. This is atherothrombosis as it should work, repair without obstruction. When repair becomes obstruction, the problem arises when this repair process is disrupted. When the thrombus fails to remain firmly adherent to the vessel wall, when it becomes friable rather than organized, when local repair propagates into the lumen, then healing becomes catastrophe. The thrombus grows into the vessel space, obstructs blood flow, or fragments break off, causing downstream ischemia. What was meant to seal a breach now blocks the artery itself. The danger of disrupting natural repair. Here lies the clinical dilemma. Many interventions targeting coagulation or platelet function are designed to prevent obstructive thrombosis, but applied without understanding the biological context, these same interventions can paradoxically convert stable wall-adherent repair into unstable obstructive thrombosis. By disrupting the organized healing process, we may trigger exactly what we hope to prevent: clot formation that extends into the vessel lumen or obstructs flow. The clinical task is to distinguish atherothrombosis, that is safely repairing the vessel wall, from atherothrombosis that threatens obstruction, and to recognize when our intervention risks converting one into the other. Thanks for likes and sharing.